Hi Farmies, I have another video for you, and this one is about hydralazine. So I gave you a blood pressure cuff so that you can remember this is a medication we give when we have high blood pressure on our assessment. So after you give hydralazine, you have to remember that you go back and check the blood pressure again and document that you have done something about your patient's high blood pressure. So hydralazine is an antihypertensive medication, and it is given for, sorry if that made you a little dizzy, it is given for heart failure, and it works because it is a vasodilator. Alright, so a vasodilator, we have had a few of those before. We know that sometimes the side effects for that would be edema. And when we dilate very quickly, we reduce preload, so we might have some reflex tachycardia. Your ATI book talks also about this lupus-like syndrome that can be a side effect of hydralazine. Special considerations, something for you to consider is that hydralazine is more effective than angiotensin inhibitors in our African American patients. And I do not know the reason for that, but I know that the side effects of ACE inhibitors we already have documented in other videos are 3 times more likely in our African American patients. So let's look at hydralazine. What is it doing? Hydralazine is resulting, when we give hydralazine, we get vasodilation. So here's your normal blood vessel. We can assume that we have already had some vasoconstriction going on, so this would be even narrower in a patient with hypertension. We give hydralazine, we get vasodilation. The blood vessel dilates, we get a lower blood pressure, we get increased removal of waste products, so this results in our decrease in BP. So anytime we decrease in BP, we have to think about the nursing interventions that go along with that. So our patients, when we are using a medication like either PO hydralazine or IV hydralazine, we are increasing the chance that our patients will experience some orthostatic hypotension. So our patients need to have a yellow armband on. We need to make sure that we educate them about what can happen if they get up too quickly with orthostatic hypotension. We could end up with an adverse event of a fall for our patients. So hydralazine, it's a vasodilator. It decreases blood pressure. We need to document, and always monitor your patient's blood pressure carefully before and after giving the medication. All right, there you have it, hydralazine.